Okay, first you need to log in by your username account and password. So, this is the Emergency Medical Plus, and we have different Medical Plus by different department. So, we have the male ER, OB/GYN ER, female ER, pedia ER, CPR, isolation, and triage. So, from triage, the triage doctor will see the patient in the triage area list. We'll open one file. And first, you need to add the diagnosis in order to start entering labs or whatever you need. This by diagnosis, we have this by codes and by keyword. Now we'll use this by keyword. So we'll just enter one diagnosis from here. After which, after adding the diagnosis, we'll enter the latest weight and height of the patient. By height, there's different units with centimeter and inches, and for weight, there's kilogram and pounds. For this one, we'll use the kilogram and centimeter. And there's different chart in patient's measurements. And the BMI. After that, we'll check the allergies. If there's any medication allergies, food allergies, any known case of chronic diseases, surgical history, past medical history, family history, risk factors, considerations, and medical history if patient has home medication and he or she is not taking the medications at home. After that, we'll enter some lab investigation if needed. We'll click this plus sign and add the labs whatever you need. There's different categories: favorites, the most common use, and the complete list, and the profile. For complete list, if you click this blood bank, all investigation from blood bank you will see from here: blood gases, cytology, every by virology, tumor markers. You just click and it will come. After that, for under radiology, again add the plus sign and you just enter what under x-rays, CT angio, CT scan, the profile, complete list, MRI, MRA, CT angio, for nuclear medicine, ultrasound, x-rays, everything is here. And then for medication, you can again click the plus sign and just search for the medication you want to enter. But some medication, there is no, it's restricted in some accounts. Some can enter only by specialist or consultant account or from OPD. Then from here, you can, example the paracetamol, you can click this sign if you want to see the description and how to administer and the mechanism of action of the medication. And the indication also, the drug interaction, adverse reaction, allergies, and contraindications, clinical pharmacology, and patient education. It can be translated to Arabic also. Then you enter the dose, the frequency, and for how many days, the route, is it stat, PR as needed, or routine, and is it regular, divided dose, tapering dose, sliding scale. But then you just enter and then let's go to the sheets. Again, add the plus sign, and from here you can enter all the forms that you need, doctor's order sheet, all the consent for blood transfusion, the death papers, emergency room assessment, VTE, the referral forms, everything is here. And we'll show you for how to see how many visits the patient did and if admitted before. Okay. If discharged, and from when was the admission and until when he was discharged. And here it will show how many times the patient visited the hospital. Some account, there are two types of this MEDICAPLUS screen. Some it will show vertically and some are horizontally. But for this one, it's vertical. So this clinical history, it will show the allergies of the patient, any risk factors, any current or not current immunization, family history, the past history, any surgical procedure done before, and the measurement, example the weight, height, and BMI, and the diet. And then for the active problems, all the past and present of the recent diagnosis of the patient will be shown here. And from monitoring, it's you can see by main view the latest only, and from tabular you can you will see from all the early monitoring of the patient, like vital signs, the fluids, any blood gases done, you can enter from here, and the blood sugar also. And then from laboratory, all the blood results, lab investigation result will be shown here. All the ordered, collected, it will show with blue one. And then if received, you will see the check mark. And if completed, the result will be shown here. If you want to see the lab investigation from before, you can click the all, and it will show all investigation taken by through patient will be shown here. And then for radiology, you will see all the all radiologic procedure done from the patient, and also you can see the report from here. But here, if patient did CT or any radiologic procedure before, you will see the report from here, and if it is done also. For medication, same, all the medication will be shown here. If she, what medication she took from the past. For intravenous solution, from this one, we cannot see from our ER account, but if from other ward, they will enter here what current IV fluids the patient is getting. This chemotherapy, from here it will you will see the legends, all the chemotherapy drugs. From chemotherapy, you can see you can enter the drug from here, and you can enter the for how many cycles, and for what medication. You can see the pre-chemotherapy, during chemotherapy, and some doctors will add additional drugs of post-chemotherapy. So from here, you can see the how many cycles the patient should get, the date of the order, and how many intervals this patient will get these chemotherapy drugs. And then from procedure, the doctors will enter all the results like of the procedure, like by echocardiography, all this, after OR biopsy result, they will see here. From services, you can add service mostly from OPD. This is done mostly in OPD. If they need ECG, ERCP also, stone removal, lymph node biopsy, and upper GI endoscopy. For appointment also, you can use this one. From operation, all the surgeons should enter all the OR requests, and it will be shown to in the operating room nurses station, so that they will know which patient is for OR, because there are some for emergency and elective, and they will schedule it. For referral, here you can add consultation to any specialties, anesthesiology, all the doctors, home care, even from home care. I think for social worker also you can add from here. And for RT, social services, if what a patient needs. And then this blood transfusion. You can see here what how many units patient receive blood transfusion, what are the components, FFP, PAC, RBC, plasma, platelets, you can see from here. And why you should write the reason for request. Maybe like hemoglobin is low, INR is high. And then from sheet, you can see all the forms from here. Admission papers and death papers, discharge papers. Progress notes, you can see all the progress notes from doctors, home service, home care, social services, and RT. They will write all their notes from here. For these consumables, this is only shown in the ward or inpatient, especially for non-Saudi patient, because they will put here what all the things, all the medical supplies used. From here you can, it will be only shown in the ward, like it will whatever the medical supply used for the patient, like the dressing, ETT, all the tubings, all the syringes, how many, it will be shown here, especially for non-Saudi, because they will calculate all the bills. For this cash deposit monitoring, it will be seen in the coordinator, where if patient needs, especially for non-Saudi, patient needs some deposit or in order to continue the medical treatment in this hospital. This is how you exit. It's really important to log out your account, because if any people will see that your account is on, they can enter anything, and maybe it will cause problems from your account. They can write anything from your account. So in order to protect yourself, you need to close. And then you one tab will show, are you sure you would like to exit? Then just click OK.